preventive care rules, these were originally effective in 2011 for non-grandfathered plans under healthcare reform, but there are some new rules that came into effect starting with plan years beginning on or after August 1st of 2012, and these are the women's healthcare requirements. In addition to the A or B rated preventive services, there's some new requirements or provisions for women, in particular, coverage of all FDA-approved contraceptives, which include a number of different types of devices. And this is effective for plan years beginning on or after August 1st of 2012. There is an exception, or at least a one-year delay for employers who did not previously provide contraceptive coverage due to a religious belief. Those employers, if they don't qualify for the exception as a religiously based employer, they can still take another year to comply with this requirement. As I mentioned earlier, there's currently several lawsuits by a number of Catholic organizations across the country that are challenging the definition of a religiously affiliated employer. The regulators gave us such a narrow definition that the Archdiocese of Chicago didn't even qualify as a religious employer. So that's one of the things that that those folks are challenging under this act. The comparative effectiveness research fee, this is one of the additional fees under healthcare reform. This is essentially effective for the 2012 calendar year, or your 2012 plan year. And the fee is $1 per member per year, and that increases to $2 per member per year after the 2012 plan year. And it's paid by the insurance company if the plan is insured, and paid by the plan sponsor if it's self-funded. This fee is set to increase in later years, and it's supposed to sunset after 2019. And several of us at Proskauer will think that it certainly could be expanded past 2019. This will be just one to watch. The comparative effectiveness fee does apply to all group health plans and HMO, regardless of grandfathered status, and this includes retiree-only plans, which are typically exempt from most of healthcare reform. It does exclude standalone dental and vision plans, and it also excludes most healthcare FSAs, as well as expat plans and your EAPs, disease management, or wellness programs, as long as they don't provide significant medical benefits. And it's interesting to note that this fee applies separately to insurance companies and to plan sponsors. So to the extent you as an employer offer an HRA that's integrated with your major medical plan, then the insurance company is going to pay the fee on the insured plan, and, and the employer pays the fee on the HRA. So we've seen it more often in recent years where an employer will obtain a plan from a carrier with a very large deductible and will self-insure that deductible down using an HRA. And so employers that are doing that are going to end up having to pay a fee on that HRA under this comparative effectiveness fee rule. The fee is reported and paid using Form 720. The IRS hasn't updated this form yet, so if you were to go pull it down off of the internet, you would not be able to find where the comparative effectiveness fee is located or any details on it. But we do have some time before the first payments and reporting is due. For any plan year ending in 2012, the report is due by July 31st of 2013, and so that's the earliest date that anyone will have a fee due under this requirement. There are a number of counting methods that can be used to count participants. Some of them depend on whether the plan is insured or self-funded. I believe what most plan sponsors are going to find if they're self-funded is that the most favorable method will be to use the Form 5500 method, but of course you should take a look at all these methods and generally pick the one that's most favorable. We have a very fulsome client alert on this subject that you can get by going to our website and going to our Healthcare Reform Task Force page that describes all of these methods in excruciating detail. One of the other requirements that you're probably at least somewhat aware of is the summary of benefits and coverage. This rule is generally effective for open enrollments and plan years beginning on or after September 23rd, 2012. It's essentially an 8-page document, and it's also accompanied by this uniform glossary of terms. And importantly, when you're handing these SBCs out, for open enrollment, and you have multiple benefit options, when a participant is enrolled in a plan, you're only required to give him the SBC for that plan in which he's enrolled unless he requests the SBC for other options. So that should decrease the burden on employers a little bit. And obviously this SBC requirement is in addition to the SPD requirement. And it does apply jointly to plan sponsors and to carriers. The carrier is responsible for developing the SBC for an insured plan, but the employer is responsible for developing it for a self-funded plan. And obviously the employer will be able to contract out to its TPA if it's self-funded, or its broker or consultant to help develop that SBC. Most of the time when there is a failure to comply with a mandate under healthcare reform, the penalty is $100 per day per affected individual. This SBC requirement comes with its own penalty structure, and clearly the regulators or Congress was intent on getting these SBCs out, because this requirement comes with its own penalty of $1,000 per offense, and each failure with respect to a particular participant is considered a separate offense. So you really want to make sure that you're complying with these requirements. You can include the SBC with other documents like the SPD, open enrollment materials, as long as it's prominently displayed. And as a best practice, we're recommending that that prominently displayed would be right at the beginning of the document, like after the table of contents, and not buried any further in the document. Some clarification came out and let us know that premiums are not required to be disclosed on the SBC. This will hopefully decrease the number of SBCs that need to be provided. And there's a bit of a nuance with respect to the timing of the initial distribution of these things. It's kind of based on the participant's enrollment status. And so it asks a question, basically, whether you're enrolling in open enrollment or enrolling mid-plan year. If your participants are re-enrolling or enrolling in open enrollment, then the SBC must be provided on or before the first day of open enrollment, beginning on or after September 23rd, 2012. So by and large, these will need to be distributed before your open enrollment for your 2013 plan year. And then once the plan year for 2013 starts, meaning the plan year beginning on or after September 23rd, 2012, then anyone who enrolls as a new hire or as a special enrollee also must receive the SBC at that time.
We do have a question that came up that might be appropriate to go ahead and answer now.
Sure.
Does an employer have to have a minimum number of employees to be required to participate? And if so, what is that number? Is that still based around that 50 number?
There is no minimum for this particular requirement. So even a small employer will have an SBC requirement, although they'll most likely be insured, and so the insurance company will be producing this, and at most all the employer is going to have to worry about is getting them into the hands of employees. But there is no small employer exception for this requirement in particular. In terms of distributing the SBC, thankfully the regulators have provided that as long as the SBC is provided to the employee and it's not known that the spouse resides at a different address, then delivery of the SBC to the employee will constitute delivery to the spouse. So generally you're able to just give these to the employees. You don't have to mail them home unless you are aware that the spouse resides at a different address. In addition, the SBCs can be delivered electronically as long as the distribution complies with ERISA's rules on electronic disclosure of ERISA-required documents. And I can get into those rules at the end if anyone has any questions, but very briefly, essentially there are two classes of employees that can receive electronic disclosures, or classes of individuals, I should say. The first class are employees who use electronic information as an integral part of their job duties and have access to the employer's IS systems or IT systems as an integral part of their job. So as lawyers, as benefit brokers, we all use email and the internet as part of our job, so we automatically consent to electronic disclosure. We don't need to sign off on getting the SBCs electronically. On the other hand, folks who do not use email and who do not use the internet as a regular part of their job duties, they must affirmatively consent to electronic disclosure. So, for example, like construction workers or wait staff, folks that normally don't use computers and email as part of their job, they need to affirmatively sign off on receiving these SBCs electronically. That's just a brief overview of electronic disclosure rules. We can discuss that later, but I want to move on. One important thing to note here is the second bullet here is a reference to this 60-day advance notice requirement that you might have heard of under healthcare reform. And this rule basically requires that if you're going to make a mid-year plan design change, and that change affects the content of the most recent SBC, then you must provide enrollees 60 days advance notice of the change. So any mid-year change that affects the content of the SBC must be provided in advance, 60 days in advance to employees. And there's an important exception for changes made in connection with the renewal. Any changes made in connection with the renewal that will be effective at open enrollment do not implicate this 60-day advance notice rule. So essentially, you're not required to distribute a new SBC 60 days in advance if you're making a change in connection with the plan's renewal. So once the SBC rules apply, meaning once you start your 2013 open enrollment or 2013 plan year, you need to provide the SBC at certain times. One of them is upon request. You have essentially no more than 7 days to respond to a participant's request for an SBC. You must provide one within 90 days of enrolling under a HIPAA special enrollment event. That's also the same period in which you have to provide an SPD to employees who enroll under a HIPAA special enrollment right. You also have to provide it with open enrollment materials, and there's a little proviso here that if you're still negotiating with the carrier and the SBC can't be provided because it's not finalized yet, then you have 7 days to provide it once the plan terms are finalized.